There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of older adults line up for routine health checkups, believing they are taking every possible step to stay safe. But what if I told you that some of those very tests, the ones your doctor insists you need, could actually be pushing you closer to unnecessary surgery, a debilitating stroke, or even a life-threatening cancer diagnosis? This isn't an exaggeration. New studies from leading medical journals reveal that up to 37% of all medical tests performed on seniors lead to a cascade of unnecessary treatments, dangerous complications, or lifelong side effects. And shockingly, 99% of people over 70 have no idea they are being systematically over-tested. One of these checkups, the number one on our list, is now estimated to be responsible for up to 5% of all cancer cases in the United States, a figure that puts it on par with the risk from daily alcohol consumption. You won't hear this from your local clinic. You won't see it on a billboard, but the truth is buried deep within the scientific literature, and today, we are uncovering it all. In this video, we will reveal the 5 common health checkups you should question or even avoid after the age of 70, and the terrifying truth about what they can do to your body. Every claim is backed by real, verifiable science. You won't believe what made it to number 2. The 5 health checkups to question after 70. Number 5. The routine bone density DEXA scan. It sounds harmless, even proactive. A quick, painless scan to check if your bones are at risk for fractures. But here's the secret that the medical system rarely tells you. Past the age of 70, a routine bone density scan can often create far more harm than benefit. This test, officially called a DEXA scan, measures your bone mineral density to screen for osteoporosis. However, in older adults, especially women, the results almost always come back showing some degree of lower density. This is often not a sign of disease, but a normal part of the aging process, just like wrinkles or gray hair. Yet this finding often triggers a knee-jerk prescription for powerful medications like bisphosphonates. These drugs are supposed to strengthen bones, but they come with a host of serious side effects, including severe esophageal irritation and, ironically, an increased risk of unusual fractures. In rare cases, they can cause osteonecrosis of the jaw, a horrifying condition where the jawbone literally begins to die. Here's the problem. Major studies have shown that for seniors with mild bone loss, osteopenia, who have not had a fracture, these medications have a negligible impact on actual fracture rates. A large study in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced their fracture risk by a statistically insignificant 0.3% over 5 years. Those women were, however, far more likely to suffer from the medication side effects. Consider the story of a 76-year-old retired piano teacher. She had never had a fall and walked daily. Her routine scan showed mild osteopenia. Her doctor immediately started her on a bisphosphonate. 3 months later, she developed severe jaw pain and acid reflux so painful she couldn't play piano. Once taken off the medication and started on a regimen of vitamin D, calcium-rich foods, and simple weight-bearing exercises, she was back to performing within a year, with 0 fractures. The 2022 Osteoporosis International Study confirms that for most seniors, lifestyle is a far better option. Strength training, balance exercises, and proper nutrition have been shown to reduce fracture risk by over 20%. Don't let a number on a screen scare you into a treatment you may not need. Number 4, the brain MRI for mild forgetfulness. When a senior starts feeling more forgetful, the natural impulse is fear. Fear of dementia, fear of Alzheimer's. A doctor's common response is to order a brain MRI. But here is the uncomfortable truth. For mild age-related memory complaints, an MRI rarely provides useful answers and can often trigger a cascade of anxiety and unnecessary procedures. The fact is, most MRIs in people over 70 simply show normal age-related changes, like slight brain shrinkage or small white matter spots. These are the brain's equivalent of wrinkles. However, the moment these incidental findings are reported, they can lead to what doctors call a cascade of care. More tests, invasive procedures, and immense psychological distress. A 2021 study in Neurology Today reviewed over 3,000 MRI scans of patients aged 70 to 85 with mild cognitive complaints. A staggering 86% showed some form of abnormality, but only 3% of those findings were linked to an actual treatable condition. This means that for 97% of these people, the scan did little more than cause fear. Worse, nearly 12% were sent for invasive follow-ups like spinal taps or even exploratory biopsies, all based on vague scan results that were likely just signs of a normal aging brain. The truth is, unless there are red flag neurological symptoms like seizures, sudden and drastic personality changes, or a rapid loss of functional ability, an MRI is rarely the right first step. A much better starting point is a simple paper-based cognitive screening test, like the MoCA or MMSE. These tests are cheap, highly effective at evaluating memory and attention, and they avoid the immense risk of panic and overtreatment that comes from seeing a normal wrinkle on a brain scan. Number 3, the routine cardiac stress test. This is one of the most common tests given to seniors who complain of mild fatigue or chest tightness. The cardiac stress test, where your heart is monitored while on a treadmill, is meant to spot blocked arteries. But after 70, especially in patients without clear signs of heart disease, this test often does more harm than good. The problem is its accuracy. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%. That means the test incorrectly says there's a problem almost half the time. This false alarm then leads to a series of high-risk follow-up tests like angiograms and can result in unnecessary stent placements or even bypass surgery. A major 2017 study in JAMA Cardiology found that more than half of all stents placed after a stress test referral were in patients who had no major symptoms and received no significant benefit in survival or quality of life. What they did receive were higher rates of bleeding, kidney injury from the contrast dye, and prolonged traumatic hospital stays. Consider the case of a 75-year-old retired postman who stayed active walking every day. He mentioned he sometimes felt tired on hills. His doctor scheduled a just to be sure stress test. The results were ambiguous, leading to a catheterization where a mild narrowing was found and a stent was placed. That night, he had a severe reaction to the contrast dye and developed acute kidney problems, requiring a week-long hospital stay. His fatigue never changed because it was never a heart problem to begin with. It was simply a sign of an older man needing better hydration. If you are over 70 and not experiencing classic cardiac symptoms, like chest pain during activity or severe shortness of breath, a stress test is a high-risk, low-reward procedure. Safer, simpler alternatives like a resting EKG or a coronary calcium scan are far less likely to push you into a dangerous and unnecessary procedure. Number 2, the routine screening colonoscopy. You probably did not expect to see this on the list. For decades, the colonoscopy has been hailed as the gold standard for colon cancer screening. However, for older adults, the calculation of risk versus benefit changes dramatically. A screening colonoscopy is not always a wise choice after age 70 and is almost never recommended after 75 unless there are specific concerning symptoms. The risks skyrocket with age. The preparation process is harsh, involving powerful laxatives that can cause severe dehydration, electrolyte imbalances, and even kidney issues in seniors. The sedation used during the procedure poses significant risk to cognitive function in older adults. Most surprisingly, the test itself can cause serious complications like bleeding, bowel perforation, a tear in the colon, or even heart rhythm disturbances. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients. They found that for every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved from cancer, but over 20 people experienced serious complications. That is a staggering 10-to-1 risk-to-benefit ratio. Even when polyps are found, many are so small and slow-growing that removing them in an older adult can cause more immediate harm than leaving them alone. The official U.S. Preventive Services Task Force now recommends stopping routine colon cancer screening at age 75 for most people. For those in excellent health who wish to continue screening, a stool-based test like the FIT test is often a much safer and highly effective option. It's a non-invasive test done at home with no prep and no sedation, yet it still catches the vast majority of concerning cases. Ask your doctor about alternatives because once you're in the routine colonoscopy pipeline, it can be very hard to get out. Number 1, the annual full-body CT scan. We have now reached the most overused, most dangerous, and most harmful checkup for seniors. Full-body CT scans, often marketed as executive health packages in private clinics, are sold with the promise of catching cancer early. But here is the shocking truth. These scans expose your body to a massive dose of ionizing radiation, and there is zero evidence that they save lives in people without symptoms. Each scan delivers a radiation dose equivalent to around 500 chest X-rays. According to a 2023 modeling study, the explosion in CT scan usage across the United States may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. This means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That is not just counterproductive, it is terrifying. The scan will almost inevitably detect harmless nodules, calcifications, or cysts that are simply a part of aging. But the moment they are seen on a report, a red flag goes up. This triggers a chain reaction of more scans, then invasive biopsies, then immense panic and anxiety, and sometimes even surgery, all for something that should have been left alone. The American College of Radiology is clear. Full-body CT scans should never be used for general screening in asymptomatic adults due to the significant potential for harm. If there are clear symptoms like unexplained weight loss or coughing up blood, then a targeted scan makes sense. But scanning the whole body without focus is like searching for treasure with a landmine detector. You might find something, but the damage from the search could be far worse. So there you have it. 5 checkups that may seem helpful, but can actually cause significant harm, especially once you're past 70. Modern medicine is powerful, but it is not perfect. Sometimes less is truly more. Before agreeing to any routine test, always ask your doctor 2 simple questions. How will the results of this test change my treatment? And what are the risks of the test itself? If the answer is unclear, or if the risks seem higher than the potential reward, it may be time to pause. Remember, real prevention starts with your lifestyle. Stay active, eat well, sleep deeply, and be a wise and informed participant in your own healthcare. Your time, energy, and health are too valuable to waste on fear-driven screening that could leave you worse off than where you started.